you today.
Thanks.
So you come in for to start getting PT lessons?
Yes.
Cool. So with that, we do need to do some exercise pre-screening just to make sure that you're fit for exercise.
Yeah.
So I'll ask you a few questions just about any conditions or diseases or anything that like you might have, just so that we know whether we need to refer you to a doctor or anything like that before we start, just so we can be safe.
Sure. Yeah.
So I've pre-filled your name and obviously date of birth and the date today. So I'll just go through the questions and it's just a simple yes or no to them.
Yeah.
Has your doctor ever told you that you have a heart condition or have you ever suffered a stroke?
No.
No? Perfect. Do you ever experience unexplained pains in your chest at rest or during physical activity or exercise?
No.
No? Do you ever feel faint or have dizzy spells during physical activity that cause you to lose balance?
No.
No. Have you had an asthma attack requiring immediate medical attention or over the last 12 months at all?
No.
No. If you have diabetes, have you had trouble controlling your blood glucose in the last 3 months?
No. No diabetes.
Cool. Do you have any diagnosed muscle, bone, or joint problems that you have been told could be made worse by participating in physical activity?
No.
No. And do you have any other medical conditions that may make it dangerous for you to participate in physical activity?
Not that I'm aware of.
Okay. We will find out. Okay. So that's just the first one. And again, I've filled out your information on here.
Yep.
We'll grab your occupation. So what do you do?
Childcare.
Childcare. Perfect. And got that information from you. So we'll go to your goals. What is your number one goal today?
I'd like to just become more fit and healthy, lose a bit of weight, and just generally tone up sort of all over my body.
Okay. And do you have a time frame that you want to do this by?
I feel like it's an ongoing thing, but like probably lose a few kilos like in 6 months or so.
6 months, yeah? Yeah, that's really good. Okay. And is there any other important goals to you in terms of that? No, just the fitness and health.
Generally,
Tone up, Okay,
Yeah.
so we'll put tone up in that one. That'll hopefully be a result of getting fit and healthy anyways.
Yes.
And what do you need to be successful, do you think, in terms of exercise?
Just some guidance in what exercises to do.
Mm-hmm.
And probably foods to eat, some nutrition advice, I guess. Yeah.
No worries. So you haven't really worked out in a gym or anything before, or?
No.
Not really? Okay. No worries. So do you currently exercise?
Yes.
Yeah? What do you do?
Just walk my dog.
You walk your dog?
Yeah.
Okay. No
A
worries.
few times, like a week,
Yeah, so 2 to 3 times in a week?
Yeah.
No worries. And how long would you say you walk?
Probably 45 minutes to an hour.
Okay. That's a good amount of time. And you don't have any of that, that's fine. So at what intensity would you say you walk your dog?
Moderate at this stage.
Moderate, yeah?
Yeah.
Cool. And I've got to ask this one, are you currently pregnant at all?
No.
No, okay. And do you have to take any medications or anything like that?
No.
No? Okay. Perfect. Now we're going to do a couple of health checks. So there's the resting heart rate. We'll use the machine as well as the blood pressure.
Yeah.
We'll measure your waist and your hip to be able to get a ratio out of that. And then we weighed you before, but we'll do your BMI, so your height and your weight, and then it'll come up with a figure for us.
Yeah.
Okay, so we'll grab this machine. Okay, right. Now where's the bend in your arm? There.
Just tears.
Just have to pop that in there. Alright. Now just relax your arm. So this will get us a good rate of where we're kind of starting with your health now, and we can hopefully like improve your numbers a little bit.
Okay, beautiful.
That's actually good.
Great.
Alright, so let's write those ones down. Perfect. Alright, so I'll get you to stand up and we will do your hips. And wait, I'll just make sure the measuring tape. Okay. I'll go from behind you. Do you mind if I put my arms around you?
No, that's fine.
So just place the tape around where your belly button is, and we'll go.
Yeah, you got it.
Actually, do you mind if this top comes up a bit? Just so
Yeah,
we can get a
that's
better
fine.
read. Is that
Yeah.
right? So if you wanna...
Just my jump a bit.
Yeah, your jumper should be fine. I think this top should be alright to measure around. Alright. And sorry, again, just pop that on your belly button. Perfect. Alright, so. Okay, and then we're just going to scooch this down so that it's around your bottom there. Okay, perfect. Thank you. So we can do some other measurements and that like for you later. And I'll grab a ratio on that and we'll record that. So these measurements here, so your BMI and your waist to hip ratio, there's certain rating that has been given out, I suppose, as a table, and we can kind of gauge where that rating is, and then hopefully we can improve on those numbers for you.
Yeah.
Okay, so your lifestyle, how active is your job, would you say?
Moderately active, I'd say.
Moderately active,
Yeah.
running around after kids?
Yes.
How active would your total day be?
Moderately active.
Yeah?
Yeah.
Okay, that's really good.
Especially the days I walk the dog.
Yeah. How many hours sleep do you get a night?
Probably 7 to 9.
7 to 9?
Yeah.
Perfect. And in the past month, how often have you been physically restricted by your health?
Haven't been.
You haven't?
Yeah.
That's good. All right. And in the past month, how often have you been emotionally affected by your health?
Not really either.
Not really? No, that's all right. That's good. And then in terms of these statements, which one would more accurately describe you? So I feel that my diet is healthy and does not require changing. I feel that there are a few changes I could make to my diet to improve my health, or I feel that my diet requires a number of changes and I'm not sure where to start.
Probably with the knowledge I have, I feel that there are a few changes I could make. The middle
changes?
one. Yeah.
Perfect. Okay.
Yeah.
So from that, we can do a bit of a nutrition consultation, and I'll just take you through like the guidelines and things that are recommended by the Australian government, and then you can kind of maybe put in some extra little tips and things for changing your diet to make it a little bit healthier for you. Yeah. Okay. So how much time can you commit to your exercise plan per week?
I think 3 to 4 times.
Okay. And how many minutes per session would you say?
45 to an hour, I think.
Okay,
Yeah.
yep, that's good. I can do. All right, and then what time of day do you prefer to exercise?
Usually the morning or possibly like the afternoon.
Okay, so you're more active then. That's good. Both. And then what days would you prefer to train?
Maybe like a Monday, Wednesday, Friday.
Yeah.
And probably one weekend day.
Okay. And then one or the other.
Yeah.
All right. No worries. And then there's a list of activities here, so fitness activities. Yeah. Just tick which ones you like to do.
Okay.
And then we can hopefully put some plans together, and you can do a bunch of different activities and kind of keep it interesting.
Yeah.
Okay. That's it. Yeah. So, and what intensity would you like to work out at? Do you think?
Moderate, I guess.
Moderate? Yeah. Okay. No worries. And is there anything that you do not like doing?
Running.
Running? Okay. That's fine. Okay, so that's treadmill and outdoor and that kind of thing. Not a big fan?
Yeah, not a big fan. I would probably prefer to do it on the treadmill than outside. Okay. But, yeah.
Yes. No worries. All right, so the least amount of running we can do. We'll try and get that for you. All right. No worries. So I'll get you just to sign the bottom of this to say that we have done that.
What's the date?
The 5th. Perfect. All right. Well, that is that consultation done. And we'll arrange a time we can organise some nutrition advice for you.
Great. Thank you.